Hi, I'm Dr. Shelley Yearsley, and I'm a licensed social worker and a licensed addiction counselor. Let me share with you today 3 really dangerous consequences of enabling. And who I'm speaking to are family members, significant others, and loved ones of a person who is in active addiction. I know you've heard it before. It's all over the internet in terms of enabling. And what we need to understand about enabling is that there are consequences that actually are counterintuitive to why we're enabling our loved one who's using substances. Well, there's some really dangerous consequences for you and for everyone within that family circle for enabling a loved one who's in active addiction and who's not ready or willing to go to treatment. So let me share with you 3 consequences for you to consider when you're trying to make decisions about what you're going to do and what you're not going to do moving forward in relationship to your loved one's substance use. So number 1, a lot of the reason why we as family members or significant others or friends of loved ones who are in active addiction enable the situation is because we're trying to keep them safe. But what I want you to understand is when we enable, we really don't keep them safe. What we do in essence is we create a situation where they are able to continue to use and manipulate that situation. And what this does is it creates more danger for them and it creates more danger for you. You may not see that in the beginning stages of substance use, but if your loved one continues down that path and it progresses and gets worse and worse and more severe, what you're going to see are more safety concerns. So the best thing that you can do is stop enabling the situation. Set some boundaries and stick to those boundaries. Number 2, the second reason why we get sucked into enabling in a situation about substance use disorder is because sometimes we try to keep those family secrets. I know, it's the ugly side of any kind of mental health or addiction medicine disorder. You know, we've been socialized in terms of media and movies and music and family culture and that narrative surrounding all of the negativity with substance use disorder or addiction in general. And so we don't want other people to know that. We don't want other people to see that. We don't want people to think that our family could have these problems. And so we try to keep it secret. 1 in 7 people in the United States right now are struggling with a substance use disorder. Now, even more baffling than that is 1 in 5 people right now are struggling with a mental health disorder. So think about those statistics. That's basically every family in America is struggling with some sort of addiction-related issue. It's either you or it's someone that you care about within your inner circle. So look, the reason for sharing that with you is because every family is dealing with it on some level, especially since the pandemic. It really has increased the level of substance use and depression, anxiety, and grief that we're seeing with patients coming in for treatment. So when you enable, we're trying to cover up those family secrets because addiction can be shameful. We don't want other people to know what we're really going through. And so let me dispel some of that myth for you. Number 1, as addiction continues, people already know. They already know that something's troubling. They already know that something's off. Just let it go, the family secret, and allow other people to support and encourage and love you the way that you deserve to be treated. And secondly, let go of the shame. Your loved one's substance use is not a reflection of you or them being a good or bad person. That's another myth that's out there, is that substance use or any kind of addiction make us bad people. And that's just simply not true. We don't feel that way about people that have a diagnosis of diabetes or hypertension or any other chronic illness. But for some reason, when it comes to substance use disorder, we tack on all these terrible labels about judging a person's character and even judging a person's worth. And I'm telling you, we just need to let that go. And finally, the third reason why a lot of my patients enable is because they're trying to keep the peace. Yeah, It's just simply easier to give in than it is to continue to argue. And in some of those cases, that fighting and manipulation and arguing can escalate to levels of violence. So if you're in a situation where there's escalating violence because of your loved one's substance use, what I'm telling you is enabling the situation is going to make it worse. It's actually not going to make it better. So seek professional help, seek support from the people around you that you trust, and get yourself together a plan. What would be really wonderful is if your family could come together and as a united front, decide on the values and the boundaries that are most effective for your family. If you're a family member or a significant other and you're dealing and coping with a loved one that's in active addiction, you can't do this alone. And that's why we give into enabling as a family member, because the pressure's too great. After all, when we enable, we're actually undoing our original goal. That's what we're doing. We're trying to have safety. We're trying to cover up those family secrets. We're trying to have peace. But what happens is by enabling, we're actually sabotaging all of our efforts that actually came from a good place. Please share this information with other people who you know might be struggling with substance use disorder within their family circle.